Hello, I'm Dr. John Hunter, Interim Dean of the OHSU School of Medicine. We are proud of the work our 18,000 School of Medicine alumni do every day here in Oregon, nationally and internationally. The Alumni Association Awards celebrate the work and achievements of just 5 individuals who have made especially significant contributions.
I was born in Cambodia during a difficult time. It's called the Cambodian Killing Fields. It's a genocide. My family and I escaped when I was a little girl to the refugee camps in Thailand. Growing up, my mom would remind us to really appreciate the amazing blessing of living in the United States. I always knew that I wanted to be a doctor because there was this doctor who saved my life in the refugee camps. I always knew I wanted to help with vulnerable populations. I just loved surgery. I just loved being in the operating room. That's what brought me joy. But I didn't know, how am I going to bring all these things together? During my residency, I did a program at Yale, which were doctors who cared about being change agents, who wanted to see how we could improve health across the country and globally. I was selected for the Presidential Leadership Scholars Program this year, and it's been a phenomenal experience. I hope that what I gained from it is the leadership skills to be able to do something good. My personal project is seeing how we can tackle the opioid crisis and hopefully help save lives. Being a part of Medicaid is a huge opportunity to be able to make sure that patients can get timely access to quality health care and preventive health care. That's why I do what I do. It's about paying it forward and hopefully trying to do something that can help make someone's life better.
I'm Dr. John W. Towson. I graduated from the University of Oregon Medical School in 1959. I had already enlisted in the Naval Reserve, which paid me through my senior year, which enabled me to marry my lovely wife. Betty was accepted to the anesthesiology residency at UCLA. She was the only woman. We came back to Portland, where I started my residency in orthopedic surgery.
I joined the faculty at University of Oregon, giving residents and medical students the opportunity to learn the skills of airway management and taking care of sick people.
I had retired from surgery, the surgical portion of my practice, in 1989, which was the year that Betty went part-time, retired from her faculty position.
Our passion had become working in underserved areas of the world. We went to Kenya, to a mission hospital outside of Nairobi, and we went there 5 years. One of the motivators for all of our activities has been faith-based.
I saw pathology that I had never seen before. I did procedures I had never done before.
My experience in Kenya was teaching nurse anesthetists. The ability to teach one of the nationals how to handle these difficult issues is the satisfying part.
But one of the major regrets I have is that we didn't start taking these mission trips the day after we retired.
That we couldn't continue it health-wise. To create an endowment to pay for medical students especially to go on mission trips was very appealing. At least 20 people now have been able to take care of people that we can't take care of anymore. The multiplication of the care is so satisfying.
The research interest really began at the medical school in Portland. It was a tremendous experience, and it really got me excited about research. It lit my fire, so to speak. I'm now a professor of pediatrics at the Keck School of Medicine at the University of Southern California, and I work at Children's Hospital Los Angeles. In dealing with children with cancer and performing research that's trying to help them, you understand how difficult it is when a loved one has a diagnosis such as cancer. What I would like to achieve is to further improve the understanding and hence the cure rate for children with neuroblastoma. It's still at 50%. Although it's a lot better than it used to be, is 50% is not great. One achievement that I'm very proud of is that a neuroblastoma cell line, these are cancer cells grown from a patient, was used to develop an antibody that's the first immunotherapeutic approved by the FDA for pediatric cancers. You would like to have therapies that are better than what we have now with fewer side effects, so we can have more of these kids get all the hair back on their head and have a normal school experience and a normal adult experience. To keep moving our field forward, we need to have a pipeline of young investigators, so if that's something that you enjoy doing, you should go full bore and do it and contribute something to helping children or adults with cancer or heart disease or whatever.
I'm an emergency physician for the past 30 years. I have practiced in a inner city urban environment at the George Washington University Medical Center for about 5 years, and then we made our way up to Vermont. The decision to run for the legislature and to involve myself directly in public service, it's always something that's kind of part of my DNA. I think physicians have a unique role in our society. You have instantaneous trust and an immediate relationship with people. It'd be a shame not to leverage some of that trust in other parts of the community in terms of giving back, and whether it be public service, whether it be a volunteer organization, or an issue that you're passionate about. One of the enlightenments that I've come to about being in public health is to understand that so much of what creates health is outside of the doctor's office. How we raise our families, how we take care of the most vulnerable, all of those things are really vital to what we do as a society to create those conditions where people can be healthy. This experience has changed me dramatically. It has shown me you can take an introverted kind of guy who wanted to work a shift in the emergency department and kind of show him the power of public health leadership to actually make a difference in the lives of so many.